There are many things that we've done that we do differently today than we did on May 31st that absolutely have improved our safety and security.
We are taking time this week to remember those murdered and those affected when a gunman walked into the Natalie building at St. Francis a year ago. St. Francis says the hospital system's approach to safety has changed in the past year.
From physical changes inside their buildings to body cameras for security officers and improving communication among staff, the hospital says safety is a top priority. News on 6's Amy Slanchik has the story.
The doctors, nurses, staff, and patients who were at St. Francis on that first day of June are forever changed.
A year later, I think the things that I've recognized is that our life will never be the same, that our life June 1st and beyond will always be different than our life on May 31st.
The day after the mass shooting, St. Francis says it put together a task force to address security issues immediately. Hospital leaders are still gathering feedback from employees and say they're constantly making physical improvements. The healthcare system also hired an outside company to look at security gaps and make recommendations.
We're still the same. It's still a safe and secure facility. We're just adding some things to it.
St. Francis can't share all of the physical changes it has made to its buildings in the last year in an effort to not compromise safety, but Security Director Julie Harris says some of the changes made so far include giving body cameras to its armed security officers and changing how employees communicate.
I can tell you that we didn't talk on a regular basis. I can tell you we all talk now. I can tell you we share information much more than we ever did in the past.
St. Francis President and CEO Dr. Cliff Robertson says when it comes to how the hospital approaches safety, communication has been key.
The biggest change, and I think we probably still have room to go, was getting because it really is incumbent on us when we see something or we hear something or we feel threatened to raise the flag and say that this interaction wasn't appropriate.
Dr. Robertson says the public may not realize just how many negative interactions healthcare workers have on a regular basis.
We've dealt with violent patients, violent family members for decades.
Now, he says they're taking a zero-tolerance approach.
Personally remember times when I was moonlighting in an emergency department in Lawton, Oklahoma 30-some-odd years ago. You know, one individual tried to hit me, I was spit on, and back in those days my assumption was that's just part of the job. We can't do that anymore.
Harris says in the past year, St. Francis has added security officer positions, but is having trouble attracting applicants. She says ideally they would hire 7 more officers.
We have 10,000 employees, which means 10,000 opportunities for see something, say something. So we're really relying on more of our employees.
Dr. Robertson says that see something, say something approach applies to patients too.
We don't live in a safe society, and the most important thing any of us can do as individuals is to do our part.
In Tulsa, Amy Slanchik, Oklahoma's Own, News on 6.